welcome to Debunked, where each month we bring personality and pizzazz to the analysis of healthcare news. My name is Arundhati Parmar, and I'm the editor of MedCity News, an online publication covering innovation in healthcare.
And I'm Samir Batra. I'm the managing director for HIP. We're an early stage venture firm.
So the first thing that we're going to discuss today is the Federal Trade Commission, and it ties to the agency's stance on non-compete agreements or clauses in employment contracts. So what the FTC wanted essentially was to bring this about nationally, and employers were sort of expecting that starting September 4th, actually, they would not be able to enforce non-compete clauses in employment contracts. But what happened was late August, a federal judge came in and said, hold your horses. I'm going to reverse this ban. I'm going to get to why in a minute, but let's talk about why the Federal Trade Commission believes that non-competes are bad. So there are several reasons why the agency believes that. Number one, if you have such a clause in your employment contract, it means you cannot pursue better opportunities, you cannot switch jobs very easily, and then worse, from an innovation perspective, it might even prevent you as an employee to start your own business. So that's one reason. The second reason is that, again, the Commission believes that this hampers economic growth. So the moment a rule, such as a non-compete, has a negative impact on innovation, that ultimately will dampen economic growth and development. So FTC didn't like that. And then thirdly, they felt that it was impeding fair competition. So again, assume that you are at a company and a prospective employer now cannot hire you because you have this clause in your employment contract. And this prospective employer could be a current competitor. And so now that is dampening competition in the overall market space. And so that was not good from FTC's perspective. So they were looking to basically implement this final rule across the nation instead of relying on state-by-state laws. But obviously this federal ruling now means that this cannot move forward. And what the judge basically said was that, hey, FTC, hold your horses. You're applying this thing too broadly, and you are, gone beyond your mandate and your authority to be able to do this. So, of course, this is on hold. We expect appeals processes to begin. But I'm kind of curious about the data, Samir, because there are states, California, where we live, where basically non-competes are not allowed. And in California especially, that's been the case since basically forever. So what does the data tell us?
Yeah, I mean, it's interesting when we started talking about this topic, I'm sitting there going, I don't know any better, right? Because we're in California. So ruling happened in 1872, okay? And then in 1941, it was codified into the Business and Professional Code. Okay, so it was put into place. And then actually in January 2024, just recently, they actually even expanded it to contract employees. So it's not just for full-time employees, it's actually for contract employees as well. So, and then other rules like failure to provide notice and all those sorts of things are sort of strengthened. So it's kind of interesting where, federal was going the same sort of direction as the state. And this, California for our state has been like, yeah, we've already been there. We're actually going to make it even stronger. If you look at the innovation cycle that happens here, all these startups that have been built, a lot of these people worked at the big companies even before the Googles and the Facebooks, right? And now they're leaving the Googles and the Facebooks and starting companies, right? So, I mean, there's pure data and indication that shows that people leave these big companies and then start the next trend of big companies, right? So it's clear there, okay? So go ahead.
I guess I'm going to play the devil's advocate, for lack of a better term, and say what folks like the Business Roundtable and Chamber of Commerce have been saying is that, this is bad from the perspective of protecting sensitive information that employers have.
Yeah, no doubt.
And also retention, right?
Yeah.
You can hold on to people for longer if you have these contracts.
It's like handcuffs. You can handcuff them longer, right? That's what it means. But here's the thing, before we even get there, so there's 4 other states, 5 almost, that also have complete sort of bans, right? So You have Minnesota, North Dakota, Oklahoma, Colorado, and New York is pretty much on its way. Like they're like literally June, July, they were finalizing. And then you have about 9 states that have certain restrictions based on income level.
Okay.
So there's non-competes based on income level. And then you have 25 states that have some other restrictions, and you purely have 12 that have like none. Like they're like, nope, full bore, non-competes, no restrictions, go for it. But and then of course, but I think the underlining factor is even with those 12, there's still some consideration of restrictions or some sort of banning that's going to happen. So everybody's sort of at some level. It does increase, like you said, healthy competition, innovation, all that sorts of stuff. The argument is trade secrets, right? Customer relationships can be under attack.
Absolutely.
But here's the interesting thing. Most of those non-competes, and I've signed or forced to sign ones that when I didn't live in California, they have time limits on them. They're usually 6 months, year, 12 months, whatever. Okay, so then what are you doing? You're just preventing the inevitable.
Right.
Sometimes high-performing people will just go sit on the sideline for a year, hang out, do some advisory work, and then boom, go join the competitor.
Right.
I did that. I did it multiple times. So I think the benefit definitely outweighs the negative part of it, in my mind. Again, a little bit of a biased view coming from the innovation and investment sort of perspective.
But what about in healthcare? Is it, you talk broadly about all industries, but I'm wondering in healthcare especially, it's a net positive, right?
Again, good and bad.
Okay.
Right? So absolutely. So the FTC ban that was proposed at the federal level did not apply to nonprofits.
Okay.
And how many of our hospitals are nonprofits? So it's like nonprofits, you can keep doing whatever you want.
Yeah.
But I think here's the thing, right? I think banning a non-compete, the underlining message that it completely sends to the employee and the employer is this, fundamentally to me. To the employee, it says, look, we value your freedom and like you can make decisions, right, based on the best interest of you, yourself, and your family. But for the employer, to be honest with you, it forces the employer to sit there and look at themselves and say, I got to create a better work environment. Like, why don't you focus on better work environment so then people won't leave you? Because that's what's going to end up becoming the differentiator, right? It's going to be like, okay, salary and everything else. After salary and benefits, what's the next thing people look at? Well, how does this employer treat its employees?
Right.
What's the reputation? What do you do there? So I think that's where my mind sort of focuses on. Now, from a healthcare perspective, there's the good and the bad on both sides, right? Physicians are suddenly, it's more flexibility, right? They can go sort of move around. So you could also argue that the shortage that you're talking about can be limited because you now suddenly have more ability to move, right? The negative side effects to me, one is it doesn't apply to nonprofits, right? So that's a huge one. The other one, actually significant, who gets maybe screwed in this is the rural market again.
Okay.
Right? If you think about it, right? It's already hard to recruit.
Right.
Now it's going to be even harder to recruit. I already face shortages. Now these people can even move, right?
Yeah.
There's no non-competes. I mean, you could imagine maybe the rural market, they're sitting there going, okay, I have this person, there's even a 1-year non-compete or whatever it is. I know they can't move to the next rural market, because let's just say it's 100, 200 miles away. Okay, I'll just move, halfway there so then I'll commute there.
Right.
Can't happen, right? Because it's not allowed. And same thing with docs, right? You're going to have docs leaving. They were tied to a rural market for some reason, and now suddenly, so I think the loser in all that, unfortunately, becomes the rural side. I think from an employee and a healthcare perspective, it's been commended. Actually, if you go read, like everybody's sitting there going, for healthcare, this is what you need to do, not just from an innovation perspective, but to tackle like shortages and physician flexibility. Now, another negative effect that has been talked about has been continuity of care, right? So I'm seeing my doc, but now my doc is free to leave. I had a relationship with him. He has no way to be tied down. Now he'll just leave for more money. And like, I just lost, this patient-doctor relationship that I had.
Yeah.
So I think there are some of those elements, but I don't know. I mean, I think at the end of the day, whenever you're sort of trying to tie people down, it's usually a negative effect.
Right.
So,
as you said, handcuffs.
yeah.
Moving on to the next topic we were going to discuss today, and that is a really interesting piece of news out of Pfizer. They just announced in late August that they were going to start Pfizer for All, basically a digital platform by which certain types of patients and people would be able to access their medications and also get same-day virtual care appointments, and then also hook up with, physicians in their own market if they want to see them in person. Really interesting because, we haven't seen a ton of pharma do that. Having said that, Pfizer is not the first company to do this. Earlier this year, Eli Lilly, if you remember, they start Lilly Direct, a nearly identical platform. I think the difference is that Pfizer is looking at patients who are battling migraines, dealing with COVID, flu, and then adults that want vaccinations.
Yeah.
Lilly has two more indications. I think diabetes and weight and obesity are also tied to this Lilly Direct. So I find it fascinating that pharma companies are now trying to bridge the gap between consumer and pharma, and they have decided that what, the traditional healthcare system is not working, and so we're going to get into this game of delivering care. And I thought it was interesting that Pfizer, in its own announcement, actually cited some data, and they pointed to the survey by the American Academy of Physician Associates that basically said that, look, 63% of Americans have said that managing and coordinating their healthcare is overwhelming, and another 65% said that, and 73% of Americans are saying that the health system is failing to meet our needs. So into this gap of deep frustration jumps in a big pharma. Obviously, Pfizer is capitalizing on the fact that it's a household name now, right? What I thought was interesting was, is this one more example of non-traditional players getting into healthcare to try to take advantage of fragmentation in the marketplace? But we've seen big-scale failures. Walgreens invested a ton into this, and then they had to pull back. So I guess my question to you is, do you think they stand a better chance of delivering care in this new format, being closer to the consumer compared to a Walgreens or Walmart, despite the fact that I always considered retailers to have a closer relationship with consumers than Big Pharma? But anyway, what's your take? Lilly first and now Pfizer.
Yeah, Pfizer for All. What a clever name, guys. So clever. You would probably spend hours on marketing. Let's come up with Pfizer for All. No, but in all honesty, look, Pfizer is basically sitting here saying, look, providers, you're failing with delivering access and care and all these sorts of things, right? So from one side, I give Pfizer kudos. Why are you standing on the sideline, right? Like, take advantage of this. Like, what do we talk about with, like, NVIDIA stock is up, like everybody's talking about AI, right? GPUs. Hey, everybody's talking about Pfizer. It's Moderna and Pfizer. It's like a two-man game, right?
Yeah.
Just saw the news, the new COVID vaccines coming out, right? It's like a now and annual business. This is your business. This has sort of sustained you through stock market. You're a household name, to your point. Strike when the iron is hot.
Okay.
I mean, seriously, right? So they're sort of watching, and like you said, Eli Lilly did this. So they're like, maybe they learned a little bit from what happened with that introduction into the market. And they're like, okay, you know what? We're selling drugs. We've always been known, pharma's always been known to be like, an arm's length away from the consumer, right? I mean, they do all this education and informational sessions, and they do a lot of nonprofit work.
Oh, they do direct-to-consumer advertising.
They do direct-to-consumer advertising, right? But the point is, they don't really necessarily have a active relationship with the patient. It's not like you're taking your medication, something happens, you call Pfizer. You call your doctor.
Yes.
Right? Or you call your pharmacist. You can't call 1-800-PFIZER or whatever the number is. But this sort of brings them closer to their customer. So, and I think it's them trying to sit there and say, look, we are building this brand. We're building the fact that people are buying and utilizing our vaccinations. So the difference that I feel with the retailers is that I don't see, to me, this didn't look like a brick and mortar and a virtual offering. This is a kind of like a pure virtual with a back end into partners, right? Like
Right.
Uptick and Alto and others.
Yes.
Right? Instacart for delivery and all that sort of stuff.
Yeah.
So I think, again, I'm not sitting here saying it's going to be successful and, great idea. Oh my God, this can't fail. But I think it's worth it for them to try, right? So I think a company like Pfizer, and I think from a business perspective, you're basically taking advantage of goodwill that you're building in the community,
Yeah.
right? So I think the focus for me is there. I think the thing that troubles me, honestly, with this whole thing is, how does this impact coordination of care
Yes.
with existing caregiver workflows?
Absolutely. I
Okay.
mean, I felt the same thing. You're again boosting transactional care, right?
It is.
Episodic transactional care.
And that's the thing. If you're focused on episodic care and
Yeah.
it's one thing just to be like COVID vaccination, talk to me, blah, 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 done.
Yeah.
But you're saying you're going to do migraine, you're going to do like
Conditions
influenza,
management, yep.
conditions management, and you're going to do all these different things. That's my concern because now it's not just the experience. Okay, so I went on Pfizer for All or whatever, and I was going to go through the thing and then I stopped. But it's a nice designed website. You can go in, start searching, all that sort of stuff.
Yeah.
Seems pretty user experience friendly.
Good.
Okay?
That's nice.
All right, so
for
yeah.
healthcare.
Yeah, so it seemed like nice.
Yeah.
Okay. But then think about it this way. Let's just say I execute an experience on Pfizer for All, right?
Yeah.
I either get a virtual consult, I get medication, blah, 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 whatever it is. Great. Now as a user, okay, and I use my insurance and all that stuff. Now, do I have data sitting in your platform?
Exactly.
Now, what am I supposed to do with that?
Yeah.
Now I go to my primary care and he's like, what are you doing? Oh, I did this.
Everything's interoperable now, right? That's the story I
Well,
keep
that's my
hearing.
whole point, right? So what are you guys going to do? So then wait, now does Pfizer for All need to have an API into there? Or like, do I have access to pulling it my side? Then do I need to have a UpHealth or like a personal, like all those personal tools that are out there, like Health Gorilla and stuff like that?
Yeah.
That's where I don't know how much thought has gone into that part.
That part was
Right,
not
and it's
revealed.
not chronic. This is the good thing is that they didn't. That's why on the Eli Lilly thing, when they're focusing on like diabetes or like weight management, I'm like, yo, that's a big thing.
Yes.
Okay.
Yes.
So maybe you can get away with like softer, less so integration capabilities with episodic care.
Yes.
Because it's very concierge medicine like.
Right.
Okay. But it still begs to differ the fact that like, do you have longevity there then, right? Like that's my issue because data integrity and ownership, we've already talked about cybersecurity. Now you're creating another wall that can be taken down.
Right.
So that's my concern. But I think it makes sense. Like if I was at Pfizer and strategy group was like, hey, we should do this. It's worth a roll. It's worth to take the dice and say, hey, let's go try this out.
Yeah.
Let's see and timing is perfect. The new vaccination is
being rolled
out.
Yep.
You're coming into flu season.
Yep.
So, and COVID was sort of a little bit of an uptick this summer.
True.
So I think the timing is good. The difference is, you're not going crazy like Walgreens, Walmart, building clinics, brick and mortar,
Right.
Doing all that integration. No, you're staying away from that. You're doing, look, I'm going to do virtual consults on the vaccination, on long COVID and things like that, and migraine, and just sort of, it's almost like they're dipping their toe in.
They're dipping their toe in, and I that's the exact same thought that I had. Is that you're creating another kind of patient record? Will that then communicate with whatever the patient's primary care person is? I don't know. I mean, I don't see that U.S. is suddenly becoming a nation of everyone wanting to vaccinate themselves, and so those are little episodic things that can happen without worrying your primary care doctor. But I don't know, they're trying something, so we'll see how it happens.
Yeah, and last point on that, like Minute Clinic did the same thing, right? When Minute Clinic came out back in the day from CVS, you had this very primary care episodic sort of transaction.
Yes.
A lot of people like me, I used it because I was like, I didn't have a strong relationship with my primary care. It was a great option when you were traveling and you got sick, you just went to a Minute Clinic, right?
Absolutely.
And then later on, CVS and Minute Clinic adopted Epic.
Right.
Right? So I think they sort of saw that maybe and said, okay, we at least need to be on the platform that a lot of people are on. So who knows? Maybe Pfizer goes down that road as well. Like once it becomes something, do they go and marry or partner with somebody that's create some sort of interoperability.
Talk to me a little bit about the partners they've chosen for this particular rollout, though. I mean, they've said that they're going to expand into other areas and have other partners, but the three that they mentioned.
I mean, Alto, I don't know Uptick as much. I know Alto, and I know, obviously, Instacart. Who doesn't know Instacart? And Instacart's played around with healthcare side, but, I mean, it's...
Alto is a pharmacy, right?
Pharmacy, yeah. They're, it's low-hanging fruit.
Okay.
Right? There's no danger. What's the danger? It's like a cupcake agreement. We call them cupcake agreements. Like, hey, I'll scratch your back, you scratch my back. When something happens here, you'll get paid. When something happens here, you'll get paid.
How is cupcake related to that?
We just call it cupcake because it's easy. Like, cupcakes are easy to eat.
Oh, so this is not a Samir terminology, or is this a Samir terminology?
I don't know. I think other people use it too. Might be mine, but no. But my point is, it's basically like a...
I didn't know about cupcake agreement.
Well, basically, it's like a glorified marketing agreement. There's not like... To me, it's not like there's hard dollars being, assigned and required. Right?
Okay,
it's not like you're
good.
It's transactional, right? So you're going to Alto and saying, look, I'm going to push volume your way, right? If it comes to you, I get paid on transaction. So there might be thresholds and things like that. It's not like, hey, Alto, I'm delivering you $1 million guaranteed a month. Here, I'm signing $1 million to you, regardless of the volume I do. That's why I call it a cupcake agreement, right?
And just a disclaimer here, neither Samir nor I have actually seen the agreements. Cupcake or not, as wonderful as that sounds, we've not seen any of the agreements. We're assuming those are the relationships, but basically the online pharmacy would deliver the medications to your home.
Instacart, same thing. I mean, it's like Instacart's probably stretching out even more because looks like, Instacart doesn't necessarily do medication delivery.
No.
Right? So, but it might be for other things because they're trying to help you with migraine.
Yeah.
Right? So migraine you might be doing other off-shelf products.
Okay.
Right? So maybe you're picking up somewhere else and delivering different products to them. So who knows?
We will wait to hear more.
But again, there's not a lot of details there.
Yeah. Well, okay, moving on from what one pharma company is doing to another pharma company. This is J&J, and J&J told... let me step back here. J&J wants to do something radical to its 340B program.
Yeah.
And for those who don't know, 340B program is a... discount program by which certain types of healthcare providers known as covered entities are able to get outpatient prescription drugs at a significantly lower cost, 25 to 50%. And the idea is that these providers are sort of nonprofits who have a huge burden of uncompensated care, so they care for a lot of uninsured patients. And their argument has been for years that without this sort of discount, they wouldn't be able to take care of these patients properly. Now, the problem is that there's been an ongoing bone of contention between pharma companies and hospitals regarding this sort of 340B program, because the pharma companies feel that this covered entity description is overly broad, and so it's not just the safety net hospitals that are taking advantage of the system. There are other hospitals that are taking advantage of it, and so they are missing out on revenue because these guys are claiming to be taking care of uninsured patients. Excuse me. So what J&J informed its hospital on August 23rd is that, hey, we are going to change the way we pay for these, the way we deliver these discounts to your hospital. They've said hospitals have to now provide claims data ahead of time, and once J&J gets to review the data, make sure that the claims data complies with the parameters of the 340B drug program, only then will it deliver these discounts. Now, this is a huge change in protocol, right? Hospitals have always gotten the discounts at the time of purchase. So the worry is that J&J is going to review all these claims and say, nope, denied, these are rebates that we're going to deny. Now, I understand pharma companies have been the traditional villains in the whole drug affordability situation. We've had people like Martin Shkreli, driving up drug prices. So in general, in the consumer mindset, in general, mainstream media, the idea is that pharma is to blame, and I don't fully disagree with that, but I also believe that there is no blameless entity in healthcare when it comes to drug pricing, and there is a lot of blame to go around. Your take on this?
This is so gangster.
Oh my God.
I love
His
it.
favorite word, gangster. All
I
right.
love it. This is like going to a junkie and saying, hey, I'm going to give you the crack, okay? But yeah, you got to prove to me that the high is going to be at this level, right? And once you get high like that, then I'm going to give you some of the money back. But you got to buy the crack at full price. But that's what it is. Right? This is so gangster. This is so nuts. I love this. Oh my God, J&J, do it. Baby, do it. Thug it out, okay? Completely. I mean, this is amazing. They're basically taking the rule and saying, we're not going to violate the rule. You know, look, you can do two things. You can either do the discount or you can buy up front and then you can do a rebate. Look, when you go to the store, right? Like, I love going to Costco. By the way, did I tell you I love Costco? I love Costco.
Costco is not taking care of
No.
patients.
My point is, you go buy something, right? And sometimes you buy something and it's like, hey, you got to mail in this thing to get $100 rebate.
Yes.
And what happens? You know what happens? A lot of people don't do it.
Yes.
A lot of people don't do it.
Because they forget to do the mail.
But guess what? The point is, the discount is still there.
There for you to get.
It's there.
Yeah.
And when I have done it, you do get your money.
Yeah.
You do get it. It might take 4 to 6 to 8 weeks, but you do get it.
Yes.
It is super clever by J&J. We're not violating the law. We're basically saying, prove it to us.
Yeah.
Right? Prove it to us. So if you think about it, they're going after the fact that they're saying, you know what, there's bad characters in here, right? There's bad apples that are taking advantage of the situation,
Yeah.
and we're not going to let them have that. Okay, from a business perspective, makes sense.
Yeah.
Hey, why wouldn't you? Your margins are going to improve, right? You're going to be capturing more revenue.
Sure.
Okay, fine. You want to deal with the headache of the paperwork and, you know, all that compliance work? That's on you. Okay, but then now you flip the script. Talk about these people who are treating the underinsured, uninsured, safety net. Man, these people are holding on by a string.
Absolutely.
Shoestring.
Yeah.
They absolutely will buckle.
Yes.
It is no question.
Yeah.
They don't have the money up front. So now you want them to pay the money up front and then basically send in a business case per time to explain what happened.
Yeah.
I mean, where are they going to hire those people to do that compliance work? They can barely do their own compliance work.
So you're saying that this is not going to fly? There's going to be issues.
There's issues on both sides. Yeah. I'm not saying that like J&J and others don't have a bone to pick with, that people have been not violating this thing. Okay, I get it, but this is like soulless. Yeah, I don't really care. I care about my margins and I care about my profits. Okay, I care about putting that nice octane in my Rolls Royce. I'm not driving on 87 in my Rolls Royce. Okay, so. Yeah, I don't care. I'm not going to violate the rule, but I'll give you the rebate.
Yeah.
I just won't give you the upfront discount. So I think government has stepped in and said, look, we need to look at this.
Yeah.
Okay?
Sure.
We do need to look at this. And I think that the way that they're going down this from stopping abuse, it's kind of like the same thing, but what they're saying is, hey, safety net and XYZ, you're obviously getting savings by having this discount. Right? So let's just say you would have paid $100, but now you're paying $50. Show me what you're doing with the $50.
Yeah.
So that's sort of what they're maybe going to go towards. Mm-hmm. So it's.
You mean the government?
The government, right? Yeah. So it's sort of a compromise. You still get the discount.
Yeah.
So the idea would be you get a discount. You got a discount. You still need to comply and tell me, what did you do with the money that you're saved on the discount?
So more accountability.
More accountability
for the hospital.
Right? Yeah. So instead of being like, no, you pay full price and then you give me data and then I'll think about giving you money back.
Yeah.
Yeah, and I don't give a shit if more people die, right? More people get sick.
I'm sure that's not what J&J
right? No, because I'll just sell them more drugs at full price.
Yeah.
Right? Because then you're going to end up in the ER.
Yeah.
You're going to end up in a trauma.
Yeah.
That's okay. I won both ways.
Yeah.
Right? You had to rebate. You didn't qualify. Now you're at the ER. Most of those places, they're buying at full price. So they're just making more money.
I'm not going to say that they're selling crack or anything, but I will say that probably a little tone deaf, corporation being a little tone deaf. Talking about tone deaf, and this is what we'll end with today, Samir. Remember when the Change Healthcare cybersecurity incident happened? Let me jog your memory. When was it? Do you remember?
March, April?
February.
Okay.
February was when it happened. And then yesterday, guess what my husband receives? He receives a letter from Change Healthcare. He starts reading it and says, there was a cybersecurity incident in February 17th.
Yeah.
So we received this on August 26th. And
it's pretty timely.
Very timely.
It's only a few months.
And 6 months, more than 6 months. But this is the pace of informing people. I mean, I'm actually shocked. But the funniest part was the expression on his face. He's like, we don't use change. So then I had to sit him down and explain that change is the lifeblood of the healthcare system, which is why when this happened, the CEO was hauled in front of Congress. But anyway, my point in bringing this up at the end of our episode today is, a little shocking that the largest health insurance company in the world and its pretty impressive subsidiary took 6 months to let people know that their identity has been stolen and that they need to be vigilant. So
I'm not shocked. I mean, look, it's a big company, right? It takes time to print all those letters and sign all of it. I'm kidding. No, but I mean, honestly, I know that because I have companies that are doing business with them.
Yeah.
And business was like halted for 6 months.
I know.
They were like, nope, can't, we got to figure out our stuff. We got to be compliant. We got to be safe before we resume conversations, contracts, all that sort of stuff.
That makes sense.
It had we talked about this. It had that ripple effect. It impacted me.
Yeah.
So I saw it.
I'm only talking about notification. It shouldn't take
it took a long time.
And the funny thing is that the letter came from West Sacramento, California, and it was dated August 5th, and we got it August 26th. So God knows where it got lost in the mail.
I think the guy was biking it down.
I know. So I think we had a fun episode discussing a lot of interesting developments. And that's all for this episode. Again, keep writing to us at debunked@medcitynews.com, and we will see you next month.
Yep. Thank you, guys. See ya.